Welcome everyone to Vagina Talk podcast. We are Dr. Alexis May Kimble and I am Dr. David Kimble.
We're two double-boarded female pelvic reconstructive and cosmetic surgeons.
This is the podcast where we have honest conversations and discuss important and often misunderstood topics. Our goal isn't just to answer taboo questions or probe into taboo-related issues, but it's really to promote healthy discussions. Hopefully that'll lead to healthier lifestyles.
Hi everyone, this is Dr. Alexis Kimble, and here's my partner and husband, Dr. David Kimble. We're here today to record our podcast, and we have a very special guest with us, one of our dear patients, Lucy, and she's here to really share her journey and story of incontinence and her treatment with incontinence at her center and with us.
Hi, Dr. Kimble.
Hi. So thanks so much for being on the show with us. We thought you're a really important guest because so many women all around the world, millions of women suffer from incontinence. It has a huge burden of disease, and unfortunately, a lot of women go untreated. So we are very excited that you'll be sharing your story with a lot of our listeners and our patients. So can you tell us a little bit about your story of incontinence before surgery?
Certainly. I think I'll actually start at the end because that's when I realized what I had not realized the benefits of the surgery until after the surgery. I had not realized how incredibly debilitating I had been living up until the surgery. So I had my second child in 2003, and several years after that, I just started slowly leaking, urinary, my urine would just, come out. And I didn't think anything of it because I was pretty active and fit. And I just figured, okay, well, that's normal. But after several years, it became so bad that I would not be able to leave the house without a pad. And so I would say for the past 12 to 15 years, I've used multiple pads on a daily basis, 7 days a week. The only times I didn't use a pad was when I was sleeping. And that was just to give my body a break from having that pad on me. And of course, I would wake up quite often, wet with urine, not fully, not a full bed of urine, but, my underwear wet. And so, I exercised a lot. And so sometimes I'd have to double up on the pads in order to take a yoga class and not be totally embarrassed. Mm-hmm. I couldn't run. So my exercise had to really be thought about quite, I really had to think about what underwear, a second set of underwear, pads, there was so much thought having to go into that it was just awful. Socializing, that was difficult, laughing too hard or maybe having an extra glass of wine and laughing, that could mean
when you have incontinence, when it shouldn't be.
Exactly. And so sometimes there were several parties that I leaked through my pants, and it's a horrible feeling. It's just embarrassing and horrible, and you just cannot, it's debilitating. But I just was so used to it. I just dealt with it, sex, that made me feel really insecure. Plus the cost of having to purchase these pads, so frequently, that was no fun. So then I started exploring, options, and I actually explored three other options before finally arriving at your clinic. So the first option I had was somewhere in Mexico. Somebody told me they would do something for me, and I was like, no, thank you. It was cheap, but I thought if there were any problems, how do I fix this? So Then about 7 years ago, I went through Kaiser, and they did something like a Botox injection in the urethra area, hopefully to keep some. I really don't know what they did, but it was um, it was not successful at all. I Within 3 days, I was back to peeing, and then they did it again, and it still didn't work. And the problem with that was that the procedure was so incredibly painful. I mean, just the pain was horrid. So then I thought, okay, I gave it a few years, and I finally did end up at your office. And as you know, there was a lot of trepidation. I was really scared. I don't do medical procedures well. I've only been in the hospital twice to deliver two babies. So I asked about 1,000 questions, about 1,000 times. I was so scared to do it. I was just scared, and I kept changing my mind, and I kept going back to the office and going back and forth. And should I do this? Should I do that? But anyway, bottom line is I did it. It's done, and it has changed my life forever. And I have the absolute best results. Your office was awesome. You were, so patient in answering all of my questions, and I even had to come back and do a check again because it'd been so long since my last set of questions. You had to check me out again.
Right, just make sure the
So
problems are there.
exactly. The process was great. I was scared to go in the hospital because now there was COVID. So I've had my surgery now. It's been February 2022. And up to this point, I am overwhelmed with how happy I am, how that part of my life is so different. It really has been life changing. And I would encourage anybody with this issue to take care of it, because just because we're in our 50s doesn't mean that part of our bodies has to we just have to render, to whatever happens. No, we can fix it. And I am a big chicken, and I was able to do it. And you checked, I had my 6-week check, or I can't remember what was the last checkup I had, but everything was great. And my life has changed. I actually, after the surgery, I actually still carried in my bag for about 6 weeks an extra set of underwear and a pad, because I could not believe after the surgery that I wouldn't need it. I just could not believe it. And I haven't used one since. And I do yoga, I do jumping jacks, I go up and down stairs, I have fun and laugh, and my life has changed for the better. Thank you.
That just makes us so happy. Thank you, Lucy, for sharing that. That just makes us so happy to hear that you sort of almost have a huge part of yourself back, part of
Yes.
things you enjoy. You feel more active, more engaged. One of the things I want to go back to and just is it okay for me to share sort of what surgery
Yes.
you had?
But absolutely.
Lucy underwent a retropubic midurethral sling. So there was a lot of hesitation in regards to slings and sort of what can happen, the process, an implant. So we're really very happy that you've had a great outcome. What was your biggest reservation about moving forward with like a surgery to address the incontinence? What was the biggest fear you had?
It sounds absolutely ridiculous, but I'm going to be honest here. I thought I was going to die either with the, because I'm just not, I've been on this earth for 58 years and I've just not had medical procedures, and I've been really, really healthy. I thought, because I had heard years back about this mesh, and the mesh coming embedded in the uterine wall, and women having, these infections, and I didn't know the difference between the sling and the mesh. And so I didn't even want to know the difference. So that was one reservation. And the other one was the anesthesia. I was really scared to go under. But at the hospital, at Huntington Hospital, the anesthesiologist assistant just put me at such ease that, yes,
Yes, happy.
That's
And what allowed you to overcome your fear of moving forward with an implant like mesh and a sling, in spite of that fear?
I think you really took the time to explain to me the difference. And I felt confident in your skills. I felt confidence in your clinic. I had not felt that kind of confidence in a previous clinic that I had visited prior to yours. And so I did feel like I was in good hands. It was just a feeling that I had, the way that you took care of the examinations, the way it was very, very thorough. I could tell that you had all of the information you needed, all of those numbers and ounces and whatever it is you were measuring. I could tell that you really had what you needed and you did what you were supposed to do, and that made me feel confident. Also, I don't remember the name of the woman who did those final tests where she was on leave for a while.
Or your
Well,
dynamic study? Yes.
yes, whatever it is that her job is to measure, I guess, whatever she needs to measure, she was excellent. That was a difficult examination, but I could tell that she had done that a million times, and that she made me feel like, don't worry, this is just part of it. And I felt that it was going to go well by the knowledge that I felt was there from the people that work for you and you, both of you.
Thank you. We work really hard to make sure that everyone who's involved in your care on our behalf sort of extends the same like standards and expectations that we have for your care. And so we're happy that she was able to kind of create that and transmit that and communicate that with you. The test that Lucy's referring to is something that's performed in the office called multi-channel urodynamics. It's an important part of the evaluation for anyone with complicated stress incontinence, or incontinence in general. And it allows us to understand the functionality of the bladder. And it did that for us, and it was able for us to help choose the right surgery for Lucy. Is there any advice you would give anyone who is considering, they're at the point where incontinence is so extreme that it's debilitating, sort of like what you described? Is there any advice you would give someone in choosing where to go, how to get their questions answered, what resources are out there, how to look for their surgeon, what to look for in general in the consultation as well?
I would say have a list of questions, have your greatest fears, top 3, and see what the doctor's reaction is to answering those questions. Because if they are dismissed or seen as not important because the doctor has done this so many times, then I probably would not go to that doctor. I want to go to a doctor who is going to affect the my life, who can answer those questions and understand. And you did, Dr. Kimble, you really did answer all of my questions. And I would say, even if you feel scared, go ahead and make an appointment. And I would definitely encourage everyone to see either one of the Dr. Kimbles here before you today, because it there was just a level of professionalism and a level of expertise that I could just tell and see. I'd been in other offices before because I did think that I was going to go through the surgery at a different office about a year prior to seeing you. And that other office did not give me that level of confidence. I did not have that level of confidence in the doctor or in her tests. And when I asked her those, I know, probably annoying questions, I didn't feel heard. And I didn't feel like that doctor, I felt like the doctor just wanted to get through with the exam, and that made me uneasy. And so, yeah, that's what I would say. And do it, because it will make a huge difference in your life. Without a doubt, it will change your life. I can't even explain the level of what's the word I'm looking for? I can't even explain the life-changing benefits of having this surgery, and not making me feel old, because I don't feel old, but that certainly made, wearing pads every day, that certainly makes one feel old. And I don't feel old, other than that little bit of, yeah.
Yeah, well, you're absolutely right. You don't have to live with incontinence. There's so many wonderful solutions. Pads aren't always the answer, although it is an option. It's not always the answer for you to sort of live the life to the level you want, and you're living proof of that. I think one of the things that I think really moved me when I saw you last was, I asked you if you would do this again. And do you remember what you said to me, Lucy?
I actually don't remember, but I know what I would say now. I would say I would do it again. I would not only do it again in a minute, in a millisecond, I would have done it 15 years ago, had I known, had I understood the benefits.
Sure. And I think that's what you told me. You told me this was the best decision you've made in the past 2 decades, and then you retracted that in the past 15 years. And I think that is a very profound statement, because it talks about, how certain you are, how really, really palpable the effect is, and how it's impacted just not you, but it has so many resonating impacts on every aspect of your life so that you can live fully.
Absolutely.
I can't thank you enough for taking the time to spend with us and sharing your story with our patients and our listeners. I think it is so important to get good stories out there, share good things. We hear too many things around the world of things gone awry or what's wrong. So I think sometimes when things go right, we definitely should celebrate it. And we're so glad that you're sharing that.
Thank you. And the last thing that I would say is, it may seem, with all the horrors that we see around the world, that, with shootings and, Ukraine and all those really big things, it would seem like, taking care of a peeing problem, seems minor, but it actually isn't, because how we feel on a daily basis does affect what we do in the world, and how we carry ourselves in the world, and how we affect other people in the world. So it's really not minor. It's actually a major quality of life issue.
I couldn't agree more with you. You could give what you have, right? And if this gives you back a huge part of yourself and all these wonderful things about how you feel about yourself, it can only do wonders with everything around you. So
Yes.
maybe that's our answer to all the this unrest around that we see. It's just starting with ourselves.
Yes, starting with ourselves. Exactly right. Because I feel confident. I feel happy.
We're so happy. So
Thank you.
well, Lucy, thank you for spending the time with us, and we will catch up with you very soon.
Thank you so much, Dr. Kimble and Dr. Kimble. Have a lovely day.
All right, bye.
Bye-bye.
Thank you so much for listening to Vagina Talk podcast. If you want to learn more, you can find us on our web, www.kimblecenterforpelvicwellness.com. See you next time.
Bye.